In 1992, I was encouraged by a doctor to take what's called an HIV test as a matter of social responsibility.
In this video, I'm going to once again talk about Christine and discuss one part of the video where she turns from just a disgusting human being to flat out evil. Surely she can't do anything worse than being responsible for her daughter's increased risk of infection, her lack of diagnosis and treatment, as I discussed in part 1, you're probably thinking. Well, think again. But before I start, I feel I have to state that I am sympathetic towards some people in this movie. I think that some of them are so desperate to be told that they're not ill that they're willing to believe anything. One such example is Kim Bannon. In many ways, her story is very similar to Christine's. Both were successful women who were infected at relatively young ages. Both talk about the HIV tests that were on the market at the time and cast a shadow on it, and both have since died of AIDS-related illnesses. But, whereas I want to shake the stupid out of Christine, I want to give Kim a hug.
In 2002, I stumbled across an article by Valander Turner and Andrew McIntyre of the Perth Group in Australia, and it questioned whether there's ever even been found a virus. I became consumed with researching this. I could read from morning till night every day, and every link to another link, and I would email to these people and say, where's the test? I want to know. Am I dying? Am I contagious? And they weren't even very kind. They were just like, read our articles again. How many times do we have to tell you there's no test?
She was dealt a bad hand by life, and things really went south for her after her diagnosis. I understand why she's pretending that she's not ill, and I believe her comments about the tests and HIV are a result of people lying to her. I do really feel sorry for this woman. Whereas Christine's different, as she was the founder of Alive and Well with AIDS Alternative, and is actively trying to get people to come off their HIV medication. And to do this, she's lying about it. And by proxy, by having her in his film, so is Brent. And I'm going to prove it. Now, to make sure no one can say, shenanigans, shenanigans, I'm going to show this next clip in its entirety without any edits.
In 1992, I was encouraged by a doctor to take what's called an HIV test as a matter of social responsibility. And I was shocked and devastated and horrified when the results came back positive. It was one of those moments that everyone fears their whole life. A week later, I take the same test to an AIDS specialist. He looks and says, this isn't a positive test. I don't know what this test means.
Since a false positive looks like a true positive, how can you ever distinguish whether it's truly a positive or a negative?
Well, that's a great question. It's going to be very hard to determine a false positive.
So I take the test again, and this time my results come back marked from the lab, indeterminate. I'm faced with the decision, do I want to wait 6 weeks to test again, or do it right away? I opted for right away. My results that time come back positive. Took it again, came back negative. I took it again, positive.
Dad, did you see it? Did you see it? No? Okay, cool. Well, never mind. Let's just start at the beginning there, shall we? She says that in 1992 she got tested for HIV as a matter of social responsibility, and that she was shocked and devastated and horrified when the result came back positive, as we all would be. She later went on to say that a week later, she took the results of the test to an AIDS specialist who said, this isn't a positive test, I don't know what this means. And at the same time she is saying this, we're shown her results on screen. And we can clearly see that the samples were collected from Christine on 02/24/92. It also says that she was tested using 2 different methods. The first was an ELISA screening test for HIV antibodies, in which she tested positive, and the second was a Western blot, which looks for specific HIV proteins within a HIV-infected cell. Christine tested positive for P24 and GP120/160, but not for any other bands. A possible reason for why there were no other bands detected is that Christine could have been recently infected with HIV, and the test was taken before the full range of antibodies had developed. I flat out do not believe that an AIDS specialist would not know what this means, especially considering underneath it tells you the criteria for the test result to be HIV positive. Specimens are considered negative for HIV-1 antibodies if no bands are detected. Specimens are considered positive for HIV-1 antibodies if any 2 of the following bands are displayed: P24, GP41, and GP120/160.
A week later, I take the same test to an AIDS specialist. He looks and says, this isn't a positive test. I don't know what this test means.
Christine then tells us that she decided to take the test again, and surprisingly, it came back marked as indeterminate.
So I take the test again, and this time my results come back marked from the lab indeterminate.
So how can the same test have different results? Well, they don't. They have the exact same result, but they're just interpreted differently. The second Western blot reported a positive result for GAG, which is for P18, P55, or P24, and ENV, which is either GP41 or GP160 or GP120. But she didn't test positive for POL, P64, P51, or P32. Even though there was no date on this test, the results of this Western blot are consistent with someone who's recently been infected. Therefore, you can conclude it was taken sometime soon after the first one, but before the full range of antibodies had developed. This is why it's recommended that anyone with an indeterminate result should return to be retested within 3 to 6 months. After that time, the POL proteins can be identified, and HIV infection can be verified. We are next told that when faced with the decision to wait 6 weeks or to get tested straight away, Christine decided to get tested straight away, and this time it came back positive. This is the first time we can see Christine's time travel capabilities.
I'm faced with the decision, do I want to wait 6 weeks to test again or do it right away? I opted for right away. My results that time come back positive.
She says she didn't want to wait 6 weeks to be retested, but the new positive results are dated 09/23/93. That's the 23rd of September for people who can write dates. 19 months after the original.
I'm faced with the decision, do I want to wait 6 weeks to test again or do it right away? I opted for right away.
And the results are positive for all 8 bands, which is an unequivocal positive result, and entirely consistent with someone who's been infected for a relatively large amount of time.
Took it again, came back negative.
I took it again, it came back negative, says Christine, who then went back in time to the 9th of August 1993 to take the test again. This time she got a negative result. The truth is, there isn't a lot of information on this picture. We don't even know what type of test was used. It is entirely possible that Christine was given a false negative from a less reliable and inaccurate test. However, I personally believe there is something more deceitful going on here. Under where it says HIV in the image, there are random black dots. This has led me to believe that this image has been cropped. Without knowing the method used, and without having access to the full and possibly unaltered document, this evidence can't be used in determining Christine's HIV status. Christine then jumps forward 6 days after her third test, to the 29th of September 1993, and lo and behold, the test is positive again.
I took it again, positive.
It should be noted that it's normal practice to immediately repeat a positive HIV test. This is in order to exclude human or laboratory errors, and to prove the presence of the virus beyond any reasonable doubt. It even says at the bottom that it's a confirmation test.
I'm very much opposed to the concept of mandatory testing of any population because the tests are scientifically shown to be unreliable and inaccurate.
In conclusion, with the exception of the August 1993 results, which I believe have been altered and lack vital information, all of Christine's results are consistent with someone who's been infected with HIV. As much as I want to believe there are Time Lords out there with TARDISes and what have you, I think it's more likely that Christine is lying about the chronological order of her tests in order to cast a shadow on the tests. Now in my mind, it's one thing to pretend to yourself that you're not ill, and it's another thing to expose your children to unnecessary risks. But to manipulate data to encourage others with this deadly infection that HIV tests are inaccurate is evil. I mean, she knows she's lying. I mean, she bloody took the tests herself, and here she is lying to promote her own batshit crazy ideas about HIV and how it doesn't cause AIDS and that the drugs are the real cause of AIDS. This is crazy. In fact, if you just want to know how crazy she is, then look no further than her organization's website, Alive and Well with AIDS Alternatives. Even though they don't believe that HIV tests are accurate, they have a page dedicated to people who have tested positive for HIV, and they don't think that HIV causes AIDS, so what is this page doing here? The website lists alternatives to orthodox Western medicine, and they include herbal therapy, nutritional medicine, naturopathy medicine? I don't know. Homeopathy, detoxification and cleansing, Ayurveda, whatever medicine, acupuncture and Chinese herbology, and imagery. Wait, what? Imagery? Yeah, apparently if you imagine yourself better, you become better. Are you high? Imagining yourself better against HIV, that's what you're going with. What? And you really want to be taken seriously? Hey, I wonder why you left this piece of information out about Christine, eh, Brent? Also, come to think of it, you must have been aware of these dates. After all, they're in your movie. Did you think no one would notice this, Brett? Eh? Now I'm going to finish by saying that HIV tests, even today, are not perfect. But nothing in the real world is. Nothing. We live in an imperfect world. There is always going to be imperfections, human errors, and just bad luck that are going to give a false result. But more often than not, these false results are false negatives rather than false positives, something which the movie completely misses out. With regards to HIV tests, there are also certain medical conditions that may mask the signs of HIV infection from certain tests. And medics are aware of this, and that's why they use different techniques. Oh yeah, that's right, there's more than one technique. And they're all quite accurate. And when used together, the likelihood of getting false positives and false negatives are incredibly low. So don't listen to these people. These tests are accurate, they do work.
Since a false positive looks like a true positive, how can you ever distinguish whether it's truly a positive or a negative?